Hi, everyone. Thank you for joining us. We are very happy to welcome Dr. Shields for a conversation that's near and dear to my heart as I spent many years in the US healthcare industry, and Dr. Shields is joining us from the United States. With that being said, I'll give a very quick intro and then hand it over for Dr. Shields. So I'm Aaron Stillman. I'm the head of product marketing at Tresorit. Born and raised in the United States, but I'm now living in Europe, and I'm very happy to again welcome Dr. Shields to talk with us today. Maybe you can give a few words about yourself.
Absolutely. And Aaron, thanks for having me today. I'm just thrilled to be here and to talk with folks in the US, but all over just about Engage and Tresorit and the problem this is really solving for a lot of us folks, especially those of us in healthcare. My name's Dr. Jenny Shields, and I am a clinical psychologist and a healthcare bioethicist, which is just kind of a fancy way of saying that I'm a person that deals with big problems when somebody's got a big question about what's the right thing to do, which is just a loaded term in itself, right? I'm one of those people that has some extra training in how to deal with that. And so, yeah, I'm glad to be here.
It's incredible to have spent, some of the time that we've had together talking about, your problems and your needs. And we'll spend some time talking about Tresorit Engage. But before we even do that and get into that, just to piggyback a little bit on your background, I know you shared your history and some of the events that you've had to sort of stand up and take that ethical knowledge and history and training that you've had. Can you talk a little bit just about your journey from, dealing with the situations you've dealt with leading up to, the service that you provide today? Because I think it's really, enlightening and fascinating and ties directly to why we're talking about Treasured Engage today.
Yeah. Well, I think like most therapists, psychologists, my physician colleagues, we all go into the work that we do just wanting to do the very best we can to care for the people that we serve. And I think every provider I've encountered has that sort of framework and mentality. And we get great training in how to do exactly that, right? We spend many years learning the different approaches, psychological theories, that type of thing. But as we get into the field and we begin practicing, we get less training around things like technology. Who would have known? And I remember, I am old enough to say that I remember the paper charting days before electronic health records were the big thing that we all had to translate to. And we thought, oh, this is so great. We're going to be able to connect with different charts and see things. And it was great. But the technology has continued to move so quickly that while we have this great clinical background and training, we have an understandable gap in our knowledge around like, how do we keep our patients' data safe? And um, especially for those of us that end up working outside of a large system, how do we continue to do that when we move outside of those traditional EHR records? And so my background as a psychologist and then moving into bioethics, I worked for a large regional healthcare system. Really loved the work, got to work with so many families and patients, and really saw the underbelly of our healthcare system, right? Imagine being the person that someone calls every time something goes wrong or haywire for a patient in the way they're cared for, or there's a conflict between healthcare administration and the organization's ethics. And it really just opened my eyes to what is this massive question of privacy, right? You have people that work within the hospital system that also have their health insurance through the hospital system. So all of their medical records are in that same chart. And should a healthcare system's risk management team be looking at the people they employ, that their records? The answer to that is no, right? How do we make sure that we're not developing stigma and bias when we read certain records in a chart? And so um, I ended up, to keep a very long story short, becoming something that nobody thinks that they will ever become, which is a healthcare whistleblower, right? Just ended up in a circumstance where I was asked a question that I thought, well, there's a clear answer here, but it maybe wasn't the answer that was in the best interest of my employer and of that health system. And as a result, really, again, just came to know the underbelly of what organizations can do with private investigators and people that are tasked with uncovering data, knowledge, and found myself almost with my feet flat going, how do I keep my information, my personal information safe from people that might have advanced ways to get that? And in that process, I think just came to know that there's a whole group of professionals who need mental health care, who are struggling in some way in 2025 and beyond with feeling okay in the world right now, but they're just terrified to get that care because they worry that their employer might see it. They might be a lawyer, they might be a doctor who has a professional license of some kind, and they worry that somebody might know that they've pursued therapeutic services and even have that linkage of their data to be able to access it. And so in finding Tresorit, really what it was for me was, what is zero knowledge encryption? And like, what does that mean? And how is that different from some of these other platforms where I can technically have a business associates agreement, store my patient data there, but that there may be eyes on that data in a way that I'm not comfortable with and that my clients might not be comfortable with.
You know, it's really such an honor to be able to like know you and know somebody who put their money where their mouth is, right? And when push came to shove, you stood for what you believed in. And I said it before, I'll say it again, I commend you for doing that. And I think we need more people who are willing to do that. I also am old enough and will share my first job. Okay, my first job out of college was at a fast food restaurant, but
Sure.
my first real professional job was in a provider's office. And one of the things I was doing was literally carrying boxes full of those medical records to a storage unit, you know?
Yeah.
And this was also when we were first implementing an EHR and a practice management system. And what I find fascinating talking to you that I never thought about after my years being in the US healthcare system was there was an incredible amount of focus on interoperability and this
Mhm.
desire to make sure that when a patient goes from their primary care physician to a hospital to a chiropractor, it's easy to be able to access those records. And what you've opened me up to realizing is that sometimes that's not a great thing if
Yeah.
you're not putting the right privacy and security in place for, let's say, the doctor or the lawyer or the CEO who has a professional license, who doesn't want their employer looking at their records and things of that nature. So that was really eye-opening when we were talking previously.
Well,
um
and Aaron, I'll just jump in and say I can already hear maybe some of the arguments of folks that might be listening of, well, there's actually these extra features, right? You can set up a system where you put an extra layer of security in the EHR. It's called break the glass, right? And that anyone that goes into that feature of the chart, that's tracked and logged. And those things are true. They absolutely are. But I think what my experiences taught me was that there are people within an institution, within an organization that, because of their roles, have perhaps an interest in that additional information and have ways in which, I felt very naive before to say, well, I have a BAA with them, right? So they have to follow HIPAA. Or, the employer can't look at that, right? Like that's protected information. And I think really it's a point of education for both clients, consumers, those that have, which is almost all of us, right, have who see a medical or a healthcare provider, how our data is stored and who has access to that, but also as clinicians to go beyond what the surface level, like, oh, well, they said it was protected, so it's protected, right? That there's an extra layer of due diligence. And we are now accessing the technology that allows us to have those extra levels of protection when it's warranted.
And I love what you said there about the BAA. I think one of the real differences that I notice when I talk to Treasury customers is they're often not the group that's trying to check a box,
Yeah,
right? There's a
yeah,
lot of solutions out there that has every bell and whistle in the world.
yeah,
And they say, we're secure, we're HIPAA compliant, we have a BAA, or we're user friendly. Like, everyone's saying everything, but those who are with Tresorit often are going way beyond just trying to check a box. They really understand, and I can tell you're one as well, that values and understands the value of zero knowledge encryption combined with some user-friendly
yeah.
capabilities that help you facilitate the work you're doing day to day. So maybe that's a great transition for you to be able to help articulate, what was the problem you were facing and what led you to getting to a place where you joined our early access program with Tresorit Engage?
Yeah. And if it would be okay, could I take just a second to maybe share because we don't have the knowledge of like even saying zero knowledge encryption, right? If you would have asked me 2 years ago what that meant, I would have been like, what? Cryptography? Like,
Yeah,
I'm a psychologist. I am not a computer technical person, and I'm still constantly learning. This is like
me
an area
too.
of continuing education, right? It's had to become one. But for those who may not be familiar, and I'll do my best to explain, but um, essentially, when you have information, right? Think I see patients in my practice, clients, they come to me, and I've got to get a sense of what's their presenting concern, what's going on with them. And because it's mental health, I might ask some sensitive questions about substance use history. Might be asking them about um, early childhood traumatic experiences, right? I'm getting a full picture of concerns that may contribute to why they're struggling today. And that information then has to somehow get to me. And because of streamlining this process of getting them onboarded to my practice, it would be impractical for the first time I get that information to be once we're meeting via video call or face to face. And so I collect that in a paperwork, a piece of a form, an electronic form. I'm sure most of you are familiar with. And so the question of how do I get that information from my client's computer to my computer in a way that is safe and secure, there are a ton of products on the market that can help me do that, right? I could just name all the different systems that I've gone through getting to this place. But as I started to learn about how certain companies then monitor that data, so technology is so great now that some of these platforms have scanners that when you upload a PDF file, a form, that it scans that information. And in a best case, perhaps it's just making sure that there's not child pornography or something else that you're storing that is regulated and problematic, right? But perhaps in a worst case, they now have a copy. They can see what's in that form. And so zero knowledge encryption, as I understand it, is a way that we use encryption through keys and numbers and codes so that when my client uploads their paperwork to Tresorit or another type of zero knowledge encryption platform, that information goes into the folder. I can see it because I have all the codes that I need, like keys to a house to be able to see it. But Tresorit, the company, doesn't have the other key to be able to access that. And so it adds that extra layer of protection that many of my clients are looking for. And so, above and beyond a BAA, I can confidently say to my clients that not only do I comply with HIPAA, but that I've taken these extra safeguards to make sure that sensitive information you're completing gets to me safely and that all the folks within Tresorit who are well intentioned don't get curious and start to peek at some of that information.
Yep. I think that's 100%, spot on. And I love, the fact that you have picked up this knowledge along your way. I similarly use analogies to explain it, and you sort of touched on it a little bit. It's like having a key to a door where you can get inside a room. And what Tresorit offers is the ability for you to create a key and explicitly give that key to somebody else. And only the people who have that key can unlock the door and go inside. And
Yeah.
one of the things, for people who explore Treasury quickly learn and realize is that we're very proud at saying, not even Tresorit has access to your information. No third party actor, no hacker, no government, nobody can have access. And ironically, I've made jokes about the fact that, if you lose your password with Tresorit, we can't always help you. There are some workarounds and things that you can do with, assigning accounts.
Yeah,
But
yeah,
at the end of the day, we do not have access to any of the data, and we are very, very, upfront about some of the functionalities that we don't offer the market because you have to be able to trade off
yeah,
some bells and whistles and feature
yeah,
functionality for privacy and security and healthcare, financial, IT service, legal service,
mhm,
these industries that all pretty much have the same use case around collaborating and sharing sensitive information
yeah.
all are the ones that are really valuing Treasurit
This,
we look
yeah.
to work with. Uh,
Well, and I just again would say for someone like me who's maybe a little bit more technology naive and has had to learn, there, if you start to look for a solution for something like this, you will find any means of zero knowledge type solutions that you can implement, but they require you to learn some basic coding and put things together. And you start going, oh, is it really secure if I'm the one who coded it, right? That's not a solution I have the ability to get into. And so I feel like what Tresorit does really well is it makes someone like me who's more technology naive and presents it in a way that is just beautifully from a like it just integrates, it just works, right? It allows me to do what I need to do. It gives me the extra protection. It may not have every bell and whistle, like you said, but it just gives me what I need to collaborate with my clients. And before Engage, it was like I would send them links for Tresorit, worked perfectly, but then it would be like, wait, how do I go back and access that document that she shared before? And let me go dig through my email. And if you've ever met an executive, a lawyer, or a doctor, email box management is also maybe not their strong suit, right? And so what Engage has solved for me is having like a single landing point. This is the place where all of your stuff will be. The stuff we're working on, you can upload, you can download. It's just this link. Come back to it. Don't dig through your email box. Come here and just in an easy to use kind of way.
Well, so I tell you what, maybe again, I think this is a perfect segue. Tresorit Engage is a new product that we have brought to the market. You are one of a few existing Tresorit customers who participated in the early access program. The real pain point that we aimed to solve is exactly what you articulated, which is offering up this room and single source of truth for collaboration between doctor and patient, lawyer and client, cybersecurity specialist and, customer. and just facilitate a project, a collaboration. We aim to facilitate long-lasting relationships. So we're looking for people and companies and customers who have ongoing projects and relationships with their customers who can work in these rooms together. With all that being said, I think what would be great is if you could share your screen and sort of take everyone on a quick little tour on, again, it's a fake room, none of this is real, but it represents the way you've started using Tresorit Engage with your patients, and just sort of talk about, the way it was before and the way you're doing it now and what you like about it. And even if there are things you don't like just
Yeah.
help everyone who's joined today listening to this, get a glimpse of how Dr. Shields uses Tresorit Engage.
Yeah, I love it. And before I do, I'll say, because I think it matters, you are not paying me to say this. Like, it sounds almost like a, let me position this little talking point. It's not. It is, I was genuinely a Tresorit customer using before Engage existed. And it really matters to my professional ethics that I only talk with folks about things that I use that practically and tangibly solve a problem for me. And I think I even told you, like, please don't give me referral points, or I don't want any of that. I just want to talk about how this has helped me in my practice. And I'm really passionate about sharing it with others so that clients can have access to a system that they can trust their data is protected. So, with that caveat, perhaps I'll share. Okay. So this is sort of how I've set up and configured my Engage room. And again, like I said, for those of us that are more technically naive, right? It's very friendly. You all followed along as I clicked into some of these different systems. And so there's the ability to add your own logo, your own brand, so that people know when they arrive at this space that they're in the right space. And very simple for my clients onboarding. I've just got 3 tabs here right now. I've got a home page where they arrive. They've got some tasks that they can complete, and then documents where when I'm requesting certain things from them, that they can upload those right away. So what this is for me is like the the point of contact when someone reaches out to me and says, "Hey, I'd love to work with you. How can I get started?" That this is a place, especially when I'm doing things like psychological assessment and other things that are very document intense and sensitive document intense. This is our home base. And Marcus Shields is my husband, right? Not a real client. But, for the purposes of this demonstration, I can say, welcome, Marcus. I'm so glad you're here, and get them oriented. And so this is just a space to say, hey, got technical problems? Here's how you get in touch, but let's get you oriented to this. So like I said, I orient them right away. There's 3 spots in this portal. You've got your home. This is where you're at. Your tasks are your personal to-do list, things I need from you, and then documents. And Treasure has some cool features too, right? Like the implementation of e-signatures. For me, it's again, as a solo practice owner, it's making my tech stack, I think is what folks call it, making that as simple as possible. To keep as few subscriptions as possible. And so having access to e-signatures alongside document, alongside email, and some of those things just makes it really useful. So it's an onboarding practice, right? I need to communicate this same set of data to every new client that onboards with me. And so with Engage, you can just copy this room, create a duplicate copy of this room so that the next person that comes on, not Marcus, but the next person, I just change out their name, and it gives them an orientation. Again, you've requested your services, and there's things, oh, I can check that off. And when we're not in demo mode, that's going to cross it off their list, right? Access your secure portal, complete the forms. In my practice, communication and privacy are just at the center. And so here's how you can get in touch with me. Here's how secure that level of contact. Because one of the things I really believe in is informed choice, informed consent. There's certain clients that they're happy to use unencrypted email. They're like, Dr. Shields, I'm really glad you're passionate about privacy and security, but I just want to send you a regular email and that's okay with me. I'm okay with that as long as they know what the risks are involved,
And,
right?
and this includes texting as well. So you're texting with your patients if they
Yeah.
want to. That's
Yeah. So
incredible.
it really, I mean, we could get into Signal, but encryption around certain things like that. Um, there's just, we want to make the process as secure or not secure as a person wants. And as long as they're informed of the risks, I'm okay with that. I just want them to be informed. So by starting from a secure portal like Engage, having them come to a place, then they can start to make some of those decisions, right? Of course, I've got my privacy disclaimer. Any psychologist, therapist, clinician should have some kind of note. This is not for emergencies. Here's what to do
I
if you're in an
love how you found the icons and you're putting like the warning sign. Like you have
yeah,
no idea how happy it makes me seeing what you did by yourself
yeah,
after, all the work that went into producing this. So this is just
yeah.
so cool.
Yeah, yeah. So as we get out of this initial homepage, we jump over with tasks. This for me can be my step of, okay, upload your documents. Here's your demographic form, your e-sign request. You can go ahead and change. It's in progress. To do, completed. Who is it assigned to? Just making it really clear of what you need to do next. And then in the Documents tab, what this for me becomes then is a living document place, right? So if they ever want to access their electronic materials, like where's that consent form? Where's that release of information? What did I agree to again? Right? People should have a right to access that stuff. And there are rules and compliance components that we have to be mindful of providers, making sure clients have access to this type of information. So with this, it's all kept right here. And I can put an FAQ form that they can just get questions answered right away. But I also use it. Let me add some session resources. Maybe we've done a mindfulness exercise that I want to include an audio recording, or I want to add a worksheet or a set of skills and tools that we've been talking through with one of our treatments. This is a place that that can go. And that again, instead of digging through the email box, they know where to go from there.
Well, Dr. Shields, thank you so much for sort of walking us through this and showing off sort of the fake room that you had created in the early days. I know that you're currently using this with your patients. I'd be curious to hear, what were those first experiences like when you really started using this with your patients? What was it like for you? Did you hear anything from any of your patients about it? What has it been like so far?
Yeah, it's always funny, I think, for us as we're adopting any new system in our heads, it's like this, oh gosh, I'm getting used to this, let me figure it out. And this is a new product to Tresorit. And so it's something that I am implementing slowly with my clients over time. I've been starting off with, like I mentioned, my assessment clients where there's a lot of this exchange of paperwork and consent forms. But what I've noticed so far is that they're not noticing it. And I think that's sometimes the best thing, right? That it just feels like, okay, here's your secure link to your portal. Click, they go through it. I'm like, okay, click, sign. I do the things. And then again, I have access to it in an interface on my computer directly where I can see, oh, they uploaded this thing. Great. And nothing makes my heart happier, again, as a smaller practice where I don't have a lot of the extra administrative assistant and the person to go through all this stuff, that I just have a nice streamlined way that I can copy, recreate, and just have a well-functioning system to get people onboarded and going.
Well, I couldn't have asked for sort of a better time spent, talking about this, and all of the, value you've sort of gotten so far out of Engage. I want to thank you again for all the feedback you've given us. It's been a constant sort of loop of, hey, we talked to Dr. Shields again. She said this, and the product team and the UX team and like everyone at Tresorit is just, you know, all over it. And I'm excited for some of the things that are going to be coming out over the next few months. If there's anything you wanted to sort of wrap it up and leave those who are enjoying this, you know, whether they're in healthcare or not, what is it that you would sort of leave as maybe the key takeaway here?
Yeah. I think if I could add anything else, it would be to say that when we're making decisions as business owners about what products we're going to use, when we're in these sectors that have a lot on the line for compliance, for security, both because we have to follow the law, but also just because we want to do right by our clients and make sure that they're well protected. It can be really difficult to find and align with companies that share similar values, right? We are seeing just the ways in which big tech continues to grow and make compromises along the way with certain things for security to add features. And I just have felt, and I reserve my right to change my mind in the future, say that with due diligence, but as it stands, every interaction I've had with Tresorit, I mean this earnestly, from the folks at the customer support level, like I was trying out this feature and it didn't work for me. Could I have a refund on that? Just the integrity behind who Tresorit is and how they treat their customers and how they're willing to integrate feedback has fostered so much trust in who Tresorit is. And like I said, I reserve the right to change my mind, but I just really value what Tresorit is trying to do here, what it continues to do, and innovate for customers to just listen and hear what the needs are, but to do it in a way that there is a mutual shared trust and integrity. Um, I just, I really, really value uh, the the way you show up to the work. So I
That,
think
that
that's
that means the world, Dr. Shields. So thank you for saying that. It's one of the things I love about being an employee at Tresorit. I've been here for 2 years. I couldn't be happier. I love the mission that we're on, the people we work with, and getting to talk to customers like yourself. So I think that's it for us today. We can wrap it up here. I hope if you enjoyed this, you can watch the other videos that we've been putting out there. You can visit Tresorit, check out Tresorit Engage, and as you can see on the slide, for anyone out there who's looking to get in touch with Dr. Shields, you can visit her website as well as some of her other social contact options. And I encourage you to do so, even if you're a doctor or a CEO or a lawyer. Everyone
mm,
deserves an opportunity to feel support and get the help that's needed. So thank you, Dr. Shields. Thank you for listening and have a good day. Cheers.
thanks so much.